Whenever a shipment of BioNTech Pfizer coronavirus vaccine arrives in South Africa, it makes the headlines. That's because the country's vaccination programme has been struggling. It got off to a late start, first using AstraZeneca's jab, but that was stopped over its ineffectiveness against the variant spreading rapidly in the country. Then South Africa turned to Johnson & Johnson's vaccine, but paused that rollout due to concerns about side effects. But with a second wave of infections now behind them, life is starting to appear normal in South Africa, but it may not stay that way. Welcome to this COVID-19 special. I'm Rob Watts in Berlin. The coronavirus situation in South Africa has relaxed in recent weeks. The country has now put one of the world's harshest lockdowns and two worrying waves of new cases behind it. The number of new daily infections is around 2,000 a day, just a tenth of what it was in late January, the second peak you can see there. But the improvement is despite a slow start in South Africa's vaccination campaign and its battle with a mutated virus variant. Adrian Kriesch reports.
Camps Bay in Cape Town. Concern about the pandemic seems far away here in the last days of summer. Many people are still socially distancing, but the mask mandate is rarely followed.
To be honest, I'm just enjoying the beach today. I missed out a lot. I feel like the weekends are just 2 minutes these days. I miss going out a lot.
I am happy that I'm free. I'm able to come to the beach and have fun with friends.
For quite some time we've missed the beach. You see, we've been deprived. Even in the heart of summer, December, we had all of a sudden lockdown. People couldn't come to the beach. We were away from the fresh air, enjoying the sea, seeing the sunset. But this is life. We're very happy that our life is coming back to normal. The economy has been open.
Unlike in Europe, where many of those countries have gone into higher levels of restriction as the epidemic gains momentum, in South Africa, even during the course of the first wave, we went in the opposite direction, in that we started off with very high levels of restriction. And then as the epidemic was gaining momentum and we weren't able to sustain high levels of restriction, we became more lenient and went to lower levels of restriction. And inadvertently, what that resulted in was a high percentage of the population getting infected.
Antibody studies show that almost half of the population of Cape Town has already been infected. In densely populated townships, the rate is even higher. The excess death rate suggests that more than 150,000 people have died of coronavirus during the pandemic. Virologist Wolfgang Preiser worries that the mutation could be more resistant against vaccines, as well as the antibodies people develop after early infections, similar to the Brazilian mutation. But this hasn't been verified by studies. There's still no proof of a higher death rate among the new mutations, and there are glimmers of hope.
Districts within Cape Town that were badly affected during the first wave seem to be less badly affected during the second wave. And that makes one think of a somehow protective effect. There's some likely evidence of some protective effect even after infection with the previous wild-type virus, now against the variant. But what we think is that if you've had infection with the new variant virus, you will be immune also against any preceding ones. And that is the good news.
Preiser and his team are already preparing for the third wave, and they're increasing testing capacities. Since so many rules aren't being adhered to, the number of new infections could start rising again.
Well, we can now speak to Cheryl Cohen, who is the co-head of the Centre for Respiratory Disease at South Africa's National Institute for Communicable Diseases. Thank you very much for joining us on the COVID-19 special. How would you characterise the coronavirus situation in South Africa? Is there a feeling that it's over the worst?
So thanks for having me. I think, right now in South Africa, case numbers are at a relatively low level, and they have been reducing since the peak of our second wave around the new year. But I certainly wouldn't characterize it as the risk is over. We know from previous waves that case numbers reach very high levels and then they came down, but there certainly remains a risk that case numbers may increase again. So right now, except in a small number of provinces, case numbers are generally at a low level, but that doesn't mean at all that we're complacent or think that they necessarily will remain at this level.
Yeah, are you working on the assumption that there will be a third wave, or are you, I suppose, hoping that it can just be avoided?
Well, so I think, if we look at or think about the possibility of a third wave, we know that we have experienced 2 large waves in South Africa, but there have been a number of studies looking at population immunity or proportion of people that have been infected in the country. And while, in some areas of the country, immunity levels appear to be fairly high, even as high as 60% in areas of the Western Cape where we know there's been intense transmission, other areas have much lower levels of people that have been infected, sitting around 30%. So based on that, I mean, it would appear to be likely that there will be a third wave, and also taking into account the fact that restrictions have relaxed substantially since the peak of the wave, mostly around trying to get the economy going and generate economic activity. So I think most experts would agree that it is likely that there will be another wave in South Africa. I suppose the difficulty is perhaps to predict the timing and the magnitude of that wave.
One of the things I suppose you're hoping to do is head that wave off with vaccinations, but the vaccination programme isn't going as well as you might have hoped.
So I think vaccination got off to a slower start than was hoped, largely related to concerns about the new variant, which did emerge in South Africa really around the time of that rolling out of the vaccination program. So up until now, about 350,000 healthcare workers have been vaccinated through a program really focusing on healthcare workers out of about 1 to 1.5 million potentially eligible healthcare workers. But I think South Africa is planning over the next few weeks, in fact, to move into a much more upscaled, intensive vaccination program. The plan, several million doses are expected to arrive in the country over the next few months. The target group is expanding within the next 3 weeks to include individuals over the age of 60, with a plan to really decrease that age band quite rapidly over the subsequent months. So there is a plan certainly to upscale vaccination rapidly, and the eventual target is really to get to about 2/3 of the population vaccinated towards the end of this year into next year. But it is unlikely.
You've had restrictions on, for example, the use of the AstraZeneca vaccine, and also there was a pause of the Johnson & Johnson vaccine. Has South Africa tied its own hands by making these restrictions?
Well, I think the two issues are different. I think the Johnson & Johnson was a pause with regard to safety concerns, and I think that that's quite a normal thing. Many other countries in Europe and other parts of the world also instituted a pause in response to the safety concerns until we got information that confirmed that the vaccine was safe. Yes, that may have had negative impact on acceptance of the vaccine, but I think that again may have been experienced in other parts of the world. With regard to the AstraZeneca vaccine, I think it was a complex decision, and I think but I wouldn't say we've tied our hands. I think now the government has really secured supply of a number of other vaccine products, which are, I suppose, coming into the country over the next few weeks.
Well, thank you very much for taking the time to speak to us. Cheryl Cohen from South Africa's National Institute for Communicable Diseases. Now it's time to answer more of your questions. Over to our science correspondent, Derek Williams.
Is there any conclusive evidence for avoiding alcohol before or after receiving a COVID-19 vaccine?
Asking for conclusive evidence for anything in this pandemic is setting the bar pretty high, which is why most of the commentary that I read on this topic has been pretty hedged. And I couldn't find any really clear directives issued by trustworthy healthcare bodies like the CDC or the WHO saying you should stop drinking completely before or between vaccine shots. Maybe it's best, therefore, to start by looking at the conclusive evidence that we do have. We know alcohol abuse is bad for your health. Pretty much everyone agrees on that. And there are convincing studies out there showing that one of the things regular heavy alcohol consumption impacts negatively is immune system response. There are other studies, however, showing that light or moderate drinking doesn't have the same impact, and even some indicating it might actually bolster your immune response. So most medical professionals appear to be adopting a kind of middle-of-the-road approach to this question and saying, hey, it's fine to have a celebratory beer or a glass of champagne after you've been vaccinated, but adding that it's never a good idea to overindulge, particularly after receiving a vaccination. After all, aside from the potential direct health considerations of that, having a hangover would almost certainly make any potential vaccine side effects even less pleasant to deal with.
Derek Williams there. And before we go, a reminder that nowhere is safe from COVID-19, not even the highest place on Earth. More than 30 climbers have just been evacuated from the foot of Mount Everest after taking ill from coronavirus. That's as Nepal suffers a second wave of infections. The country's tourism sector depends on the thousands of people who come every year to climb the world's tallest mountain. It's now trying to recover from a total shutdown of the Himalayan summits last year. And that's all from this DW COVID-19 special. For more, check out dw.com/COVID-19. Take care.